Hi, my name is Gail Wetzler, and I'm a physical therapist in Orange County, California, and I'm privileged to be also the director for the Barral Institute and bring to you a little synopsis of what is it that we in the Barral Institute are able to share with you. And one of the bigger, most phenomenal programs is the Visceral Manipulation program. I tell you, the changes that occur in our bodies. As a manual therapist, as a physical therapist for years, as owner of my own practice, and working with other movement patterns, manipulation, exercise, the addition that visceral manipulation has to your particular program that you have in your private practices or in your clinic. And I just want to share with you a little span of that, because visceral manipulation can work from pediatrics to geriatrics. And if you are specifically working with children, and some of the common disorders that happens with children is colic and constipation. And there's more issues, of course, but those particular, if you combine the work that you already know with cranial, massage techniques, physical therapy techniques when we work on the spine and torticollis, those torsions go deeper in the system. And as they're deeper in the system, they involve the protective mechanism in the body. So the sphincters in the body can close off if we have a torticollis baby. And if we have a colic baby with the immaturity of the sphincters, imagine with visceral manipulation, knowing where that work is, knowing where the neurovascular centers are, and connect that up with the vagus nerve that might be proposing that. And moving on into orthopedic problems, when you have spinal dysfunction, and you guys have worked on your manual therapy, and you've done exercise, you get in positional strains, but there's still a piece missing. And then we go to the research that's being out there in delineating somato-visceral connection. So what's on the neurophysiology part that is being missed with your manual therapy? A huge connection into the science field. And we're still doing more research on that. But what we're discovering and the changes that you don't find, you do a manipulation and 2 days later and 10 days later it's back again. Visceral manipulation gets to the cause, the effect of what is happening between the spine and the whole anatomy that carries through our body. In working with women's health, we deal with so much with chronic pelvic pain, endometriosis, the chronicity of bladder dysfunctions that are happening. And we are able to distinguish between what might be causing the bladder to be in a certain position that causes incontinence, or a bladder that causes an increase in inflammation. Is it a positional change? Is it the chronic pain of endometriosis that has specific laying down of adhesions that we are able to get into and change that environment and get the vascularity in there and create change of pain? Because pain by definition is lack of blood supply to the nerve ending. And then as we go on and working with our sport athletics and dancers, and the intricacy of dance, and where they may not be able to gain range through their ligament system if it's held up in the thorax. With dance, with equestrians, with the sports that we do, so much is in this thoracic cage of 150 joints that are not able to connect and move easily. So the visceral carries you through to the possibility of the pericardium, of the pleura, of the relationship of the pericardial ligament systems that actually attach to the neck, and the opening up that that will do for sports and their events to make them more efficient and more proficient. So you have a plethora of opportunities to come in and join us in visceral manipulation and see what it does for you and make a change for your patients.